Everything you do here, here, or here goes in here and ends up here. Over-applying chemical fertilizer on your lawn leads to chemical runoff in our waterways. Waste that goes into storm drains becomes waste that pollutes our streams. Pet waste left on the ground washes into our water along with harmful bacteria. Help keep our water healthy and safe. Remember, if it's on the ground, it's in our water. Learn more at mark.org. How you handle your lawn care impacts our water and air. In 1 hour, a gas-powered mower produces the same amount of
call our meeting of the SEAC on October 9th at 6 p.m. ready to go. No, this is actually how we sit. No, maybe it's not. That's okay. Let's go ahead and do our attendance. Jess Loya. Here. Peggy. Here. Martin.
Here.
Kathy.
Here.
Cy.
Present.
Marcia.
Present.
Moving on to approval of the minutes. Can I get a motion to approve the minutes from our September 1st SEAC committee meeting?
Move to approve.
Second.
All in favor?
Aye.
Any opposed? All right, moving on to comments from the public.
Yes, now it's better. I'm not going to go over the whole thing, but this is about a resolution submitted to the City Council regarding the who gets to make appointments to the committee. Again, the City Councilor thought that it should not be a resolution, but maybe an ordinance. Now, he's at this point had it for several weeks and has not gotten around to redoing it. So I'd appreciate it if the committee could take a look at it, and if you agree with it, reach out to the city attorney and prod him a little more, and I will continue to do so as well. But this is just a simple clarification to make it easier the next time around. Thank you.
Tony, city councilor or city attorney?
Huh?
City councilor, Tom Barzee?
Tom Barzee, city councilor.
Okay.
Not the city attorney. Good correction.
Anthony, can I ask you a question? So what is the difference between the resolution and an ordinance? Is that correct?
Well, I'm not really sure. I think it could be handled by a resolution. Tom Barzee felt that it should be handled maybe rather by an ordinance to amend the ordinance, the original ordinance forming the committee. So at that point, it's essentially stalled. But he will get to it eventually, but the more pressure and the more nagging, the better to get him to decide which way to go with it. It wouldn't take much reformulation.
I have a quick question.
Yeah.
So the things that this is meant to lay out, for the rest of the committees, boards, commissions, and so forth, is it a ordinance where the structure is laid out for them?
No. This is because this is really the only committee in which you have the kind of appointment structure in which the members of the city council get to appoint.
Okay, that makes sense.
That's where it's different. The others are appointed by the mayor and confirmed by the city council. So it'd be just to this committee.
Okay, thank you.
2 questions.
Yes.
Does this match, this is such a weird question, does this match the email format that Steven sent out?
don't know.
Okay. If not, I just want to make sure it's like the easiest. It's still, we either need to switch the emails or switch the labels.
Yeah, I don't know.
Okay, so that's something.
But
we need
that's
to
why
talk
it's a
about.
draft.
Yep. And then is there a reason the at-large position is not on here?
Well, again, that's appointed by the mayor and again confirmed by the city council.
But there's no end date to that position?
No, there was no proposal to change that. It's just to clarify how the other appointments are made. Because there was some confusion over it last time around.
Got it. Thank you.
Uh-huh.
Any more comments? Going once, going twice? Okay, then we will move on to appointment of committee officers. All right, so last time we were here, we left off at nominations from last month and wanted to make sure that if anyone wanted time to think about it or needed to be able to oppose a nomination for hatred of a person they were being appointed with, just in case, they were here to be able to do that. Consent matters. So last meeting, it was Jess for secretary. Bess for co-chair. And I feel like I put your name in the hat, Marcia, sorry, for co-chair. Has anyone decided if they would like to, one, take their name off, that is an option, or put themselves up for a position?
I mean, I will say that I did think about it. I don't think that I am great for the secretary position. I just like in the moment taking notes. Honestly, when I prepare things for this committee, I have to take extra time to take my own thoughts and organize them in a way that makes sense to everybody else. So probably not the best position for me, but like always here to assist.
We will need a secretary. I believe it is a required position. So does anyone see themselves fit for secretary?
If it helps, I mean, anyone decide. Megan does the minutes, so it's not there's not the responsibility of doing the minutes. I mean, if it helps, that sometimes that is seen as part of the secretary.
What does the secretary do?
I think it's a ceremonial. I'd have to check, but I mean, the only thing I could think of is if by chance both co-chairs couldn't make it, there is an officer then to slide up.
I still think Jess should be the secretary based on some of the work she has, or some of the thought she's put into the work we want for record keeping of the group. And I think that falls outside of the purview of Megan. Just saying. And I think the research that you do is extensive. And I think it's incredibly thoughtful. So I would really hope that you would take that position.
I'll second if there's any consolation.
So if the position is ceremonial, then why do we have it? Like, what is the point of it? Is this is this a state requirement? Is this?
The ceremonial is probably not the perfect word to use, but typically the secretary does the minutes of the meeting, but staff has always done that. And you're right, that's it though from staff. I mean, there are it's probably a Tom Barzee question as to why it's in the bylaws, and could be, yeah.
And I think you said, Mike, maybe it was you said last time that the magic corporate phrase that secretary just assists with other duties as needed, right? That's kind of the long and short of it.
Yes.
Jess, I see this as the perfect position for you because it's very vague, it needs to be grown, and it needs to have a little thoughtfulness put to it. So I think that kind of describes you.
I'm going to
Except not
reiterate,
vague.
I just don't personally have the time to dedicate to other things as needed and try and navigate like what we already do and my child and my life and work. And so I was just trying to remove myself as much as possible from that so I can continue to do the thought things behind there, but not have like a responsibility other than our meetings and getting things in time for the agenda, if that makes sense.
But what if we called it like secretary and researcher?
I think those are two very different things.
Not in my book.
I can do research and not be the secretary.
But if all it takes is calling it and researcher.
It doesn't. That's not.
Again,
I just don't have the time to like definitively commit to a responsibility of anything potentially added.
Who was our current secretary?
Apparently none.
unsure.
Okay.
Probably someone who is no longer on our group.
Okay.
But I couldn't tell you.
I want to say I was probably the last secretary of the EIC back in 2020 and then 2021. And then I think
I'm sure we voted someone.
that didn't happen. I'm good. But we can get the chair votes out of the way for Marcia and Bess.
I am still willing to serve in a co-chair capacity, but that is that a co-chair? So, Marcia? I am willing to serve in a co-chair capacity, but again, it is a co-chair, so there needs to be the second part of the co-chair, which would be another co-chair.
My concern is that with my work travel schedule and not being able to make quite a few meetings, I don't want that to be a hindrance and would like there to be someone who is, consistently able to come to meetings.
I think that's why we have two of them, right?
Do we have the capacity to, in a situation like this, to team somebody in so they could actually be live in the meeting and hear what's going on? So, because maybe that will help some of our attendance issues.
Capacity, yes, we can do that, the technology to do that. I know there's some limitations on when it's videoed like this, when someone's teamed in, they have to be visible the whole time. I mean, when they're speaking, the public has to be able to see who's speaking. Yes, we have like I said, we have the technology to do it. I know, during the pandemic, there were virtual meetings, but if I remember right, or I'm guessing, I wasn't in this position at that time, but where we were, when we did virtual meetings, we had to suspend public comment because it was just too difficult to show. Just keep the screen with all the commissioners where I was, and all the public attending. So comments could be sent in ahead of time. But things like that, I know there's some steps that we would have to go through and I'd have to verify. It's possible, I'd have to find out. If in Kansas, you could call into a meeting, a commissioner could, or a council member. But we're in Missouri. That question hasn't come up since I've been here.
I will
So-
say during the pandemic, we didn't do that. We had phone calls. So
I thought they did virtual meetings.
we did virtual meetings, but if you had a public, like I think it was after like the first 2 or 3 virtual meetings, if you had a public comment, you could email in your public comment and it would be read by a council member
Yeah.
or the mayor. And then you could literally like call in and speak, and you spoke at the beginning of the meeting. Like you spoke, but your face wasn't on there or anything. But every member was present. I just
Right,
don't.
you have to see them. Yeah.
Is Granicus an option for this? Don't they have like a module for this?
I don't know.
Okay.
I'm not the Granicus person. I'll find out.
Okay.
But yeah, I don't know.
I will ask is anyone else interested in being the co-chair?
I will say this, in the interest of moving this forward, concerns with attendance. That is kind of the reason why there is co-chairs. It's a redundancy thing. So it's meant to cover that. Is it going to cover that on an absolute basis? Absolutely not. Like, there's always going to be considerations that we have to have going forward. But that is kind of the purpose of having the co-chairs, is to have some redundancy for those kind of things. Not to try to continue to like force it towards you.
Here's another question. If I say yes, that is a big if, and something happens where, let's say, there are more members who come on to this wonderful committee, can that designation be changed if needed? Okay. Well, in that case.
Yeah, it can be, a position can be resigned as chair or secretary.
So sure. Let's go ahead. Why not?
Okay. For the sake of expediency, then, I move to vote for Bess and Marcia as the co-chairs, and I will take the currently not whatever secretary position, but again, like, do not have a ton of extra time for other things as needed, but am already dedicating a ton of extra time to this committee, so we'll just roll it all in.
Well, if that was a motion, I second it.
All in favor?
Aye.
Aye.
Any opposed? Cool. Moving on. That was the appointment. And then next we have a public health presentation. This is, Lauren, is it Chrome? Chromie. I've only seen it in email, so it's nice to meet you.
Yeah.
And
meet you.
we can't wait to see your presentation.
Yeah, so I'm going to pivot a little bit from what I had initially planned. So for a little bit of context, I was sent actually a screenshot of a Facebook post. I believe it was you kind of talking about the name change in some comments, and that there was, and that there was a meeting going to happen about the name change from Equity to Enrichment. So I came to the city council meeting that night because as a health department, we just had to go through that exact same thing. So we wanted to offer a little bit of support. It's very difficult to change the words and make sure that we are maintaining exactly the work that we wanted to do. So we have ourselves gone through a very intentional process of being almost more explicit in what we're doing. So instead of saying, we're going to do this DEI program, we are very specific about we are going to do this program in this place, doing this thing for these reasons because this data supports it, rather than backing off. And I know there were some concerns about that. I met with Mayor Smith shortly after that and just kind of offered to come in, offer our assistance. And part of the reason I would like to offer that to you is because we are working on something called Health in All Policies. So Health in All Policies is what we are trying to build. And essentially what that means is that we would like to be more involved in helping committees exactly like yours, city councils, county offices, to integrate a little bit of a health lens into their policies and planning. The reason for that is because clinical care really only makes up about 20% of what shapes our health outcomes. About 40% of it tends to be social and environmental factors. Our built environment, so like the actual sidewalks, things like that, tend to kind of account for another 10% or so. And then the health behaviors are 30%, and a lot of those health behaviors are shaped by the social, environmental factors that we talked about. So you're going to be less likely to eat healthfully if there's not a grocery store. You're going to be less likely to exercise if you don't have support or a community that values walking and biking. It's harder to get gainful employment and therefore have health insurance if you are not in a community that values that. So typically, the rule is that engaged communities whose voices are being heard, tend to be healthy communities, and healthy communities tend to be engaged communities. So we want to kind of offer our assistance where we can in shaping some of what groups like this do so that we can both get the co-benefits of that. So that's kind of, and I'll give you guys a little handout as well. This wasn't the core of what I was going to talk about. So when I had talked to Mayor Smith and Kim, they had mentioned that, the name change does feel like a really big change, and that you guys might be interested in having us kind of help a little bit. But I do see on your agenda that you already have some strategic planning conversations going on. So I will give you kind of just a rundown of the information in this packet, maybe give you some context. I know that what I want you guys to understand is that this is very much supplemental to what you already know about your community as you're planning kind of your next steps and what you would like those to be. And then from there, you can ask me any questions that you'd like, and we can talk about whether or not you would like to do what I originally had planned on a future date, which is to kind of create a focused conversation using this data to find a shared understanding with, new people being appointed and a little bit of a reframe, find a shared understanding of what exactly that looks like, and then work that into either adjusting a vision and mission statement if you already have one, or creating a new one, whatever that looks like for you. And I'm happy to share the resources that we've been using along the way to do that. So for North Kansas City, what you should know as you're kind of trying to get that community engagement is that the median age is 47.1 years old, so just kind of right in the middle. It's about a 50-50 split between male and female with a small margin of error, so much like other communities. Typically, this plays out pretty normal. We've got a little more diversity here than in other communities. So it's about 64% white, 14% black, 6% Hispanic, 2% Pacific Islander, and 14% identify as multiracial. The median income is approximately $46,000, 9.7% poverty rate, so 4% for children, 11% for seniors. 93% have at least a high school diploma, and 31% have graduated college. So this is a relatively educated community, which is great, and 8.2% are veterans. So this information is just going to kind of frame the info that we've pulled. So some notes on this was data taken from our Community Health Assessment Survey. This survey is specifically representing 64116 and 64117 zip codes. That's the most we could break down the survey information. So I know some of that falls a little bit outside of city limits. This specific survey was conducted at community events, so we got a lot of responses from people who are already very involved. So those tended to be responses from white cisgender women. It's about 70% of our responses. 83% were white. 95% speak English as a primary language. We know that those numbers are not necessarily representative of the demographic makeup of North Kansas City. When we extrapolated that survey out for the whole Northland, it matched the one that we sent through another company to get a representative sample. So most of the answers were pretty much identical. So while they're not necessarily demographically the same, when we take it out to the larger area, we were seeing the same responses across demographics, and those were weighted. 57% of the survey takers were married. 10% of our survey takers identified as LGBTQ. 25% said that someone in their household had a long-term disability, and 57% had a college degree, which is higher than the overall percent of degree holders for North Kansas City. But still, again, when we extrapolated it out, answers were very similar. And then 49% of our survey takers were ages 25 to 44. So again, age-wise, not entirely representative. I just kind of want to give all of those disclaimers. So when we look at what the community said, we found that the biggest reason that people find it challenging to walk, bike, or use a wheelchair, scooter, or other mobility device is a lack of sidewalks or paths. But 37% did say that they did not find it challenging to get around here. This is a relatively walkable community. So there's still work to be done. 23% said too much traffic. 21% said that sidewalks were blocked or broken. 16% said crosswalks were an issue. Loose animals are about 18%, and 24% feel unsafe. 23% of those respondents said that it does sometimes make it difficult to reach necessary resources. So groceries, childcare, employment, getting to health appointments. When we talked to some community experts about survey responses and got their take on it, a lot of people that do work in that biking and transportation industry said that one thing that they hear a lot is that people can't get to bus stops near them. So that's why it tends to be a barrier to people getting to places. It's not that they're walking all the way to the grocery store, for example. We know that's really far away. But if they were trying to get to a bus stop and they couldn't because the sidewalk was broken, or they didn't feel like they could walk to that bus stop safely, that's going to impact their ability to get to other places. 29% of respondents said that they have had to choose between buying groceries and paying another bill within the past 3 years. Again, keep in mind that this is a relatively privileged response group. So it's very likely that that rate is a little bit higher. It's tough right now, so anything we can do to kind of create that sense of community can really help people feel supported, especially if we can find ways to meet those needs while we do it. And in the past 3 years, people said that 23% said that sometimes they have been worried that their household would run out of food before they had money to buy more. Now, we know that those often numbers are a lot lower, but when we actually take those percentages and spread them out, that number tends to be really high. 7 or 8% of a lot is a lot. Overall, people had pretty mixed opinions on how they would rate the health of the Northland community. So here in North Kansas City, 28% said somewhat unhealthy, 29% said somewhat healthy, so most people kind of falling there in the middle. And then 26% said that they were healthy. Only 3% said very healthy or very unhealthy. So at least we're not hitting extremes, but most people are kind of ranking it to the middle. So we could be better, we could be healthier. In the past 3 years, 30% of people said that they have had the difficulty that housing is not affordable here. There is not enough housing, 11% of people said. 16% said that their housing is in disrepair, so things like mold, broken railings. 3% don't have stable housing. 2% have experienced or are currently experiencing homelessness. We did not get any evictions in this survey here, so that's good. People are at least able to stay. 9% said that there were not enough shelters. That is a difficulty they have run into. And the other 61 said that housing has not been a challenge for them. So still the vast majority are able to be safely housed. But those numbers are a lot. So I won't go through every single one of these, just the ones that seem kind of the most relevant. 15% of people said that they would rate the community fostering a sense of belonging as a top 3 strength. Only 12% said that social services and resources are easy to access. Only 9% said that the cost of living was affordable, 10% that there are affordable options for recreational sports. But you did rank very, very high in walkable neighborhoods and public spaces. That's 30%, and that's a pretty high number with so many options. Same with public parks, trails, and green spaces are plentiful and accessible. 49% of respondents from North Kansas City felt that that was the case. Strong public schools and K through 12 education opportunities. And then the libraries and other free community resources are available. Again, 49% is a really great number for this many options. And then based on experiences, so this isn't necessarily data-backed. It is somewhat data-backed, but what people are seeing, what they are perceiving as challenges to health behaviors, kind of things that are issues in the community. Alcohol misuse was 31%. Now, I will say that is going down, but it is still an issue in the community, really across the country. Drug misuse, 45%, so that's very high considering the number of responses. Mental and emotional health problems were 49%. So those being the really big ones is kind of where you guys come in, because mental health is very impacted by feeling engaged and that sense of belonging in our community. So the 3 factors that people think are the greatest challenges to being healthy here, again, I'll just go with kind of the extremes. Most people feel like there is a really good education system here. Only 7% think that that's a challenge, which is great. And only 9% feel like discrimination is a challenge. That could very well be because of who was answering. But people seem to think that homelessness is a big problem in this community, even though it's not quite as pervasive as some other areas of Kansas City. A lot of people rated lack of time for self-care, so physical activity, stress management, even social outings as one of their main challenges to being healthy. When we talk to a lot of community experts on the subject, and I mean everyone from schools to employers to hospitals, they were kind of reiterating the same thing. It's really, really hard to go to work all day and be exhausted when you come back and then still want to go out and do things in your community. It makes it really difficult. So if we can kind of find ways to meet multiple needs at once, we're more likely to get people moving. So say like if there was like a walking group that was free and people could come out and get their social needs met as well as their physical needs, that would be awesome. And then housing insecurity. So homelessness, we know based on data, is not actually as big of a problem as people are perceiving. It's just very visible. Housing insecurity, based on the data, is a big problem. And that could mean anything from not knowing if you're going to be able to pay your rent or just having housing that's not particularly safe or healthy. Overwhelmingly, I know that we are in an era where it feels like there are 2 sides and everyone is with us or against us. But overwhelmingly, we found that there are community policies that support health that people in the community really value. So we essentially asked people if they supported the following policies, and they could answer yes, no, or unsure. Pretty much all of them were a yes. So 55% of people support prohibiting the sale of flavored tobacco products. 80% of people want to ensure park access for all residents within a 10-minute walk of their home. 88% want to increase the number of trees in the community. 92% want to ensure that rental housing meets basic health and safety requirements. 90% want to ensure high-quality, affordable preschool and pre-K programs are available for residents. 68% agree with providing no-cost legal representation for eligible tenants when they're facing eviction. 53% want to place limits on alcohol sales, including locations and number of stores selling alcohol. 72% support placing smoking and vaping limitations on indoor and outdoor public spaces. 82% support requirements for city governments to prioritize sustainable practices when they purchase items and services. 84% want to support requirements for employers to offer accrued PTO for employees that are working more than 20 hours a week so they can rest and recover and find that self-care time. And 90% supported ensuring that everyone, including pedestrians, cyclists, motorists, wheelchair users, and people who use public transit, is able to safely use streets regardless of their age or ability. So there are so many things at a community level that all of us agree on and can absolutely make lots of progress on, whether that's through advocacy, whether that's through events. So then we pulled some data. The North Kansas City area tends to be kind of right in the middle with diagnosed depression among adults. So we're looking at the 22.6 to 23.8% range. There weren't really good ways to break this down just within the census tracts of North Kansas City, so you can kind of just see in this graphic comparisons to the rest of the Northland. So it's not like the worst, but it's about average for Northland. Out of our survey respondents, they said that in Clay County, people have experienced over 5 mentally unhealthy days in the past month of when this survey is taken. So that's a little bit concerning. That doesn't necessarily mean diagnosed clinical problems, but it does mean that, like everywhere, people are feeling social isolation, they're feeling stressed, they might not feel like they have a good sense of belonging in their community. Obesity among adults here is kind of in the 35.6 to 39.6 range, which is not great, but it's, again, not the worst. Like compared to the rest of the Northland, you guys are doing okay. And part of the reason for that is there's a little bit less physical inactivity here than in other places. So you do fall into the 22.9 to 27.2% range on no leisure time physical activity that adults are reporting. But there are so many great community assets here that I think if we really play up, that could change that. You know, I worked for the Y. I still teach at the Y, so I'm a big Y fan. But I know they're always looking for things that they can help with. The library does really amazing things that gets people involved. Mackin Park is like an incredible community resource. And the level of income inequality here is pretty moderate. So what that means, what the Gini coefficient is measuring for anyone that doesn't know, is basically how big is the gap between the highest earners and the lowest earners. So the closer you get to 1 is like the worst. So we're at about a 4, so 0.4. There's a relatively high social vulnerability index number here compared to the rest of the Northland, and a lot of that is because there are so many people that have kind of moved into the community new to the country, which is awesome. Love that for them. But they definitely have a little bit more vulnerability, especially right now. So making sure that, you know, people are housed, people are fed, they're not going to slip through the cracks. So like I said, engaged communities tend to be healthy communities, and that includes civic engagement, people who have a hand in their policies, not just the big elections, but the small ones too, tend to have healthier communities. There's more involvement, the people are voting for their needs. So Clay County itself has about a 50% voter turnout rate, which is higher than the overall Missouri number of 46.9. But it can and should absolutely be lots higher, lots higher. Clay County also has less social associations. So Clay County has 8.9 social associations per 1,000 residents. So those include things like civic organizations, community centers, fitness centers, sports organizations, religious, political organizations. So we're a little bit behind on having things that people can get involved in. But one thing that this particular area is crushing it at is parks. So the percentage of the population here that has a park within a half a mile is pretty darn good. So 63.5 to 89.4 in that general range. But then we can kind of get into the North Kansas City specific data. So a lot of this is pulled from Census Bureau. Some context here is the numbers in this big census block look really extreme, and that's because comparatively not that many people live there. So we don't have an exact number, but basically if the numbers seem like they're rapidly swinging back and forth, it's because it takes a very small number of people to change, and we actually don't even have, there's so few people that we actually don't even have good census data for all of these metrics in that area. So we do know that renter excessive housing costs per housing unit are a little bit high, and that is the case everywhere. This is not a North Kansas City specific thing. You can see they're kind of lowest right in the census block here. They are highest right in this dark census block right here. So renter excessive housing costs is basically, if you are a renter, do you pay more than 30% of your rent? So if the average person in that area is making a certain number, is 30% of that going to cover housing costs? If it's not, then it is considered excessive. That number is much lower for homeowners typically because they're not as subject to market fluctuations. You can still see the patterns are basically the same, but the numbers are much lower. So instead of, the 40%, we're talking about 3-4%. And then median household income, again, we can kind of see like comparatively, it's really high in that block that not that many people live in. It's mostly businesses in this block. So all it takes is one person with a really high income back there to make it look way higher than the rest. We can see that where the excessive housing costs are highest, that tends to be where the median household income is the lowest. So that's something we're going to want to take a look at. And then we have our low income population. So it is 200% of the poverty level or below is considered low income. And you can see that's a lot of those census blocks. So really stretching from here to actually almost exactly here to about 269, just south of Avondale, and kind of running along 210. 53 to 56% of people qualify as low income. I thought this would go a lot faster, or I would have put it in a PowerPoint. So the education, like I said, you guys are actually a very educated community. We can see, the thing I actually thought was really interesting when I was going through this, I wish we could do an overlay, is that the education and income does not necessarily overlap. There are some areas of similarity, but you can see that especially in, it's 2025. So, there's a pretty high level of education right here in this block struggling the most with housing costs and income. You guys are, as I said, absolutely killing it on walkability. The average for the Northland as a whole is about a 10 out of 20 on the walkability scale, so 20 being the best, 1 being the worst. That's decided by the EPA. So overall, the Northland gets a 10. North Kansas City overall has a 15. And you can actually see that some of your census blocks are in like the 19 range. So like almost perfect walkability, which is great. You just kind of want to extend that into this little stretch and then into this little pocket kind of right behind where we are now. And some of that's just high traffic areas. So when considering community engagement, we definitely want to talk about internet access. There is still a really high level of internet access here, but there are still some pockets. So the area here, like I said, most of it is going to be just 2 to 5% of the population. Maybe up to 20 right here, but I doubt it. That's a really big pocket. It says 5.3 to 19.9. I would guess that it's much closer to 5 than 19 in the low income but high education pocket. And then where it looks really, really dark blue down here, that's again where not that many people live there, so it doesn't take a lot to skew the data. And then commute to work. So I included this because it is a huge factor in social isolation and mental health. Long commutes to work, which are defined as 30 minutes or more, especially if you drive alone, tend to increase people's stress. They increase people's level of social isolation. If people can figure out ways to take public transit or bike or carpool, those numbers tend to look a lot better in those communities. So right now, people who have a long commute to work, most people don't. The census data actually shows that most people's commute to work is less than 20 minutes in North Kansas City. But the people who do have a long commute to work, it's, this block right where we are and then right behind us up toward Cherry Street has about 30% of people that have that long commute alone every day. So finding ways to combat social isolation there, even if it's just trying to get people to organize carpools, creating a little bit of structure around that can do wonders for social engagement and mental health. So taking this data, I hope it's helpful. I hope it supplements kind of what you already know as you are planning. But after the meeting, if you guys would like to chat about talking with me about some of our health and all policies things, and how we can facilitate some strategic planning assistance to help you incorporate that health lens, I would love to talk to you about it. There's literally no obligation. Yes or no, it will not hurt my feelings, but I would love to help you out. And then I will make sure you each get one of these before you go. Do you have any questions before I?
I was just going to say thank you so much. That was awesome. I don't know if you can hear me. No one ever
Yes,
can.
I can hear you.
This was really cool. Also really ties in with some of the things that we are going to talk about later. The why is absolutely, it's in my committee member comments because they talked about it at city council yesterday, because we can see the part of that we are paying for, how much usage there is. And I think those numbers are pretty low, seem to be the consensus from council. And yeah, I figured this committee could find really good ways to sort of make that more of a North Kansas City community space, do really fun activities or even challenges or groups, walking groups. But also so the data that you gave us right now is awesome and definitely adds to what we already have. But I think in certain aspects, what we have is pretty limited.
Okay.
Because something else I'm going to bring up later is collecting data so that we can do some strategic planning. So us doing our own surveys and stuff like that. Would we be able to reach out to you guys if we have a more dedicated information ask, other questions or?
Yes. So you can absolutely reach out to us for that. Part of the help that I wanted to offer, kind of the technical assistance, is strategic planning and facilitating some of those conversations around how do we create concrete plans and not use the words that are not allowed, but also make sure that we are incorporating everybody and we're being very intentional about that. But we definitely, I mean, we just finished doing our community health assessment. So surveys, data, that is all what we do. We do have more. Some of it is limited, but also part of what I do are things like policy scans and health impact assessments for programs and policies, so we can kind of talk about how we can best partner.
I had a couple of questions.
Yeah.
But first, I also want to echo what Jess said. Thank you so much. This was awesome. It was a great supplement to, the things that we are trying to learn more about now. So I was wondering, not necessarily the raw data, but like the collection that you've gone through the effort to put together, is it available somewhere online to peruse and that kind of thing?
So
is it a
yes.
public availability thing?
Yes and no. I mean, you guys are welcome to share this wherever, and I can send out a digital copy. So we have our community health assessment dashboard that is online, and I'm happy to give you that information. It is for the entire Northland, so it's a bigger picture. This was North Kansas City specific. So the CHA is great, and I would love to take you through the dashboard and kind of show off all of our hard work over the last couple of years making it happen. But it is going to be Platte and Clay counties together. Part of the reason that we do that actually is so we can kind of compare around the Northland. There's a lot of movement, a lot of fluctuation. Like I work in Clay, live in Platte, used to be kind of vice versa. So we wanted to treat it as one community because it really is one community. But if you guys are looking at this specific pocket, then that's stuff I would have to pull for you specifically.
Okay, yeah, that makes sense. And that kind of alludes to exactly why I was asking, being able to poke at it and play around with it. I was curious at the beginning, some of the survey data, particularly like walkability, sidewalk, stuff like that, just as a small example, including 64116 and 64117, like the vast, I don't know how much 64117 is in North Kansas City proper.
Oh, none of it is? I was told
None.
by our data team that a piece of it was.
No, North Kansas City's all 64116, and then
Okay.
64116 is also a little bit north of us.
Yeah.
Yeah, I know
So-
64116 has some overlap, so.
So that's why I was asking
Okay.
about it, which even including both of the two zip codes together, this was insanely useful. The other question that I had was, is this something that you all do on a routine basis?
It's something we're trying to do on a routine basis. So that's kind of ideally, I was actually in a different role until about a year ago. So we're building up that health and all policies that I was talking about and trying to really make sure that you guys know that we're a resource and act as a resource, because when we incorporate that health lens into policymaking, we do kind of tend to incorporate everything that goes into health. So what you guys do affects people's health, and people's health affects what you guys do. So it's all very integrated. So yes, this is something that we want to be as involved as you'll let us be.
Well, that's great, and I look forward to seeing where it goes from here.
Yeah, absolutely. So
Is it possible for you to tell us more about the program? Was that what you were coming here to talk to us about originally?
So sort of. What I was actually planning originally, I didn't realize how formal of a meeting this was. I was thinking it was more of a planning meeting. So I was planning on facilitating a conversation to just kind of get a shared understanding using this data of what enrichment means and where you think that you would like to go, and then if that's something that you would want to continue with and maybe go into activity planning and subsequent meetings, then that would be something. So I apologize for requesting 2 easels and not using them. I had a whole workshop planned, and then decided to pivot since I saw you already had strategic planning items, and I didn't want to go completely off topic of what you were doing or overlap with what you were already doing. So if that is something you would like in the future, let me know and we can schedule that. They tend to be really useful. We did them a lot for our CHA when we were doing our community health improvement plan, which is also on our dashboard, and planning our activities. It's what we used. And then as we were going through kind of our rebrand and reframe of a lot of our programming to make sure that we were, I'm using compliant, but I'm going to use air quotes because I mean compliant very sarcastically, to make sure that we didn't set off any red flags and can keep providing services. We really decided we didn't want it to lose meaning or get watered down, so we took it back to the strategic plan, back to the community health improvement plan, and went from there on being specific and made sure that we were all still on the same page. We all had the same overarching ideas, and then we were able to change the words from there in a way that was still very explicit about what we were doing, who we were trying to serve, and what our mission is. So we would also love to help you with that because I know that it feels like a really big lift and it's not a particularly fun lift. So yeah, that's something that we can also discuss.
Thank you. Are there more copies of that?
Of the packet?
Yeah.
I have a few more.
Okay.
Yes. Did you guys not get packets? Okay.
Yeah, I know.
It's because we started chatting about biking, and then I got really excited, and then, okay.
Wow.
I'm just going to correct myself. Cerner campus and across Shoto from Harrah's entrance, the gas station, Poor Boys, and then some businesses in there that are in North Kansas City are 64117.
Okay, I thought that there might be like some tiny sliver.
Yeah.
Yeah.
No residential properties, but yeah.
Any other questions before I?
No, just an immense amount of gratitude for all this information and
Yes, thank you.
ways to implement it right away. Thank you
If
so
don't
much.
mind, I might just sit and be like a fly on the wall while you discuss your strategic planning. And
Perfect.
Totally fine.
If
If you want
ever,
to do some art,
yeah,
that
draw us a
captures
picture.
the rest of this meeting.
Like, I mean,
I would love that. I didn't
was-
have a live painter at my wedding, so now's my opportunity.
We can have a live painter.
Yeah.
meeting. If ever there is a way that we can better connect the North Kansas City residents with information that you guys have, whether it's at like, exactly, which also tied in, that was just the note that I had on there, but I was like, that's perfect. But yeah, like when we're at a commit, like a event or something, if there's things we can hand out or talk to people about, or yeah, just send them our way.
All right, well, let us move into our discussion of next steps. Let's start on our updates on groups from our homelessness initiatives. Buddy bags, not buddy bags, our little backpack guys. We'll come up with a better name. Yeah, I think we. So little backpack guys it is. No, oh no, it's Lil, like Lil Sebastian, which I'm working on a campaign for North Kansas City. Not a Lil Sebastian, because he's, our flying guy in the sky. But Barry the black squirrel, the black squirrels in the neighborhood. Working on it. I have not done enough for this one. I'll go ahead and guarantee you guys that. But Martin, if you could share our contacts with the lovely girls of the Equity and Committee meeting, or the Equity and I don't know what the group is called at the high school, and I don't want to misname them.
Okay, that's the North Kansas City Cultural, Multicultural Festival usually. Actually, there was no response. They had some turnover in terms of the liaison that we usually have,
Okay.
so they should still be getting back in contact with us.
Okay.
But what we did, instead of that, we put a lot of emphasis, me and Peggy and myself, on the Northland Assistance Program. We went there and had a meeting. We have some information to pass on.
Yes, and she is not interested in the bags. So we were thinking of doing
Exactly.
another, like other groups or places within North Kansas City that would have the ability to share them more fluidly.
Yes.
And I was thinking of talking to the high school group to potentially do some sort of drive for supplies for the backpack.
That would probably work out great. One of the main reasons that she's not interested in the bags is because they really already have that done. I guess I'll just segue into what we had.
Perfect.
We met with them, and I think that that organization, the Northland Assistance Program, is a diamond in the rough, basically. I don't think we access that organization enough. The people over there, specifically Rita and Nancy, incredible people. They got a lot on their plate, and I had no idea that they had a full food pantry and so forth. A lot of resources over there, and they are really in tune to collaborating with this organization for betterment of the community. There's a lot of resources that we could point people to, specifically in the areas of homelessness. They have a program that they work with several other organizations in terms of houselessness and everything, and they seem to already have it down. And they don't need a lot of assistance other than maybe a little bit manual labor. They need those ladies need a little bit of help in getting when the food and so forth is donated from usually a church or something, collects it, and when they pick it up, they really don't have a lot of help in unloading the food and taking it to their pantry, which is already established. So that's one of the main things that we need, that they need over there. Some assistance, basically. I suggest, and I was going to contact the school about this, but they didn't get back in contact with me yet. I suggest that some of the high school students would be down to actually do that. And it happens on at a specific time. It's I think it's the first or third Wednesday. Yes, it's the first and third Wednesday at 8:30 a.m. Usually that's when they do it. So that's a kind of inopportune time for high school students to be helping out. We understand, but that's one of the main things that Rita and Nancy explained that they need. Other than that, they need to spread the information about the organizations that help them out. And for that, I'll let Peggy continue. She has notes also.
Okay, we talked about food drive. I was already working with them on a food drive just for the Northgate Village area, but we were trying to do something bigger than that. We don't know if it would be possible to do a citywide food drive. For that, and they do get food, but they're missing a lot of foods. They're missing a lot of staples. I don't know, people are bringing in stuff that they really aren't needing. They need like cans of soup. They need condiments. They need, I had a list, but what we talked about is if we could do a citywide food drive and have it to be as a Christmas food drive. And she recommended if we do this, that we could start in early December and then have the food to the center in mid-December. And they also need help, and if we did something like that, help would be needed to unload and bring the donations upstairs to the pantry, because you walk in that door and you have to go up the stairs, and they can't, she can't be carrying all the food up, and they don't, or we get volunteers that would be there and carry the food up. And yeah, mid-December, okay, and also to help transport the donations, collected donations to the assistance center if we are able to do this and businesses buy into it, or even, the police department, fire department have a competition who can collect the most food, or just, but they would still have to have a way to get that food transported from wherever the collection barrels are to the assistance center. I mean, this is kind of a big thing. I don't know if this is something that the city's ever done before, but that's pretty much what, and then definitely like ingredients for a holiday meal is what she was talking about. Because they had, I think that, didn't she say something about turkeys? I'm trying to see if I had that. Yeah, they have a turkey dinner, but that was not, that was in November. But as far as Christmas is the one that she thought that they really need. Yeah, Thanksgiving they have like turkey in a box, but that's from Mega KC that's giving them that. So that was kind of what we came up with when we met with Nancy. We just talked about the kind of help that they need, bringing the food in from the people that, sometimes there are people that are dropping off food at the curb, but they really not physically able themselves to carry that up. So the high school kids need service hours, that might be a place to do it. and just the Christmas food drive. I think that was it.
One last thing, the naming of the Christmas food drive, Rita wanted us to make sure that we went through the proper channels in terms of that name is going to be, let's say, legal, let's say within the laws of North Kansas City, to name a North Kansas City Christmas food drive. Is that okay? Is that okay with, there may be some legalities in there that we wanted to make sure that we clear before we go full speed with this.
Probably a council, I mean, just to clear it. I mean, there's a legal aspect, but then also, you know, yes, it's a city event, I mean, kind of thing, because that'd be my first thought.
I mean, it's definitely something I think we should talk about at council. Even get like just as y'all were talking, I was thinking at like the Christmas festival, the mayor, Christmas tree lighting, like have a table, have a space. Even y'all sitting there receiving the food so you can talk to people was one of the first things I thought of. So I think, yeah, definitely a conversation to have with council. And if y'all want to come up with a name, I'm sure it'd be as simple as like approving it. And then, yeah, just thinking through even more ideas of how we can make it accessible to everybody in the community. Even like volunteers to go, I don't know, again, just thinking like, I'm thinking about my kid, like bring a wagon around and like, hey, do you have any extra like cans in your pantry you're not going to use or whatever it is. So yeah,
We
I think
leverage
it's
the
worth talking
cute
about.
faces. That is
Exactly.
absolutely important. Yeah.
A little like 6-year-old asking you, come on.
Could we make it like a ward thing too? Like whichever ward does the most gets bragging rights for the year or something? Like, I don't know. Like,
Oh, I like
way
that.
it gets people
That's
into
cool.
it. And then we could make like pickup
Yeah.
centers here or the Y. And then honestly, for the other part, we have that Neighbors Helping Neighbors ad hoc committee that is like recently getting together, helping Rita in the mornings at 8:30, the first and third, like they might be able to either figure out people who can assist with that or themselves assist with it. And then the other one is, I know there is a lot of kids at the high school who do like community service projects. And it's also possible that they could just be released from the high school for 8:30 to whatever time to go help Rita. It's right across the street. Like, exactly. They would love it. They'd be like, yeah. And then I was going to ask, so the bags, the bags that we're gonna
Little backpack guys.
little backpack guys that we are the little backpack guys that we are Lil Sebastian, little backpack guys. Is there any way? So I again watched the council meeting last night. It was really interesting, Kristen. I really appreciated your question. It is very much so in line with this committee. I do think that it would be really great if you guys could kind of reconsider that with Rita and the need for a social security card. It's not that it's not incredibly important. It is. It's just that I don't know if it's not a requirement. I don't think that we should like bet somebody's life on it personally. So that was my only thing from last night. And if that is a thing, is there any way that we as a committee could work with a Turning Point, I believe is who she said was doing that, to help connect the people in our community with that service and or keep pushing them towards it? As Rita was sort of mentioning, they've been working the entire year to like push people to get their documentation, and a Turning Point can help them. Yeah, that's what she said. She spoke at the city council meeting last night, and if you haven't watched it, you should, because she came in like fully, she had all sorts of information. I will say the only thing she didn't have is the information, like data, and if it's possible to make it, because I realize she already does have like 9 million things on her plate, could we possibly at some point, also, again, later going to talk about a subcommittee for this, but could we possibly really like sit down and talk about what data we need. What information exactly are we trying to get from what sources? Is it going to be them? And that way, when we are, asking Rita for information, which I think this has kind of been like a year after year thing with city council, like, we don't really know, like, they don't really know necessarily. And I do think it is our jobs to look at it with that lens and figure out, like, what data are we actually requesting? Not specifically for the cold weather shelters, but so that we can get a full picture, because Rita is like the only boots on the ground in North Kansas City. We don't have any other real resource for the homeless community. So having whatever ability Rita has to give us information would be really fantastic, and anything we can do to help facilitate that. And then with the bags, I do know that like one of the biggest issues that she kept bringing up last night is that like people aren't necessarily the most apt to share their information or stories. So is there ways that we can think of that we can make that anonymous or like low effort, taking into account, like, there's different things. It's possible to put little surveys in the bags that maybe they could drop off. It's not guaranteeing that they're going to do this, but maybe it has, like, a little QR code on it if they have a phone they can access it with, or have these available at the library, or so that we are specifically gathering data from the community that we're trying to assist with this subcommittee.
I think that's completely reasonable. I also think I wish there were an easier way for us to be available to talk to people. I think it's on, I promise.
I know, we just aren't.
No, I just have a scratchy voice. It's just, I'm still sick, it's fine. I think the reason I want us to be, I think the thing about a QR code or a paper survey and like saying, hey, drop this off somewhere, is it doesn't lead to connection. And I think one of the biggest tragedies of houselessness and like being on the outskirts and being on the fringe is that lack of connection. And if your main goal is, well, you have to have this paperwork or you have to have this thing done, it is an opportunity to break connection rather than to build connection and have a relationship. So I almost wish there was like a way to do both.
Yeah, I think that is the point. So when we're out there talking, I mean, like, I think I have a lot of contact with that community, and I know a lot of the people in our community. So yes, obviously, like individually, if we wanted to like have more conversations with people, try to get them engaged, ideally even possibly at the table for the conversations that we have, so that they can help sort of form. But that's not necessarily a guarantee. What I'm talking about is just we need to develop multiple ways that we can connect, get information that specifically pertains to the communities we're serving. So this isn't just specific to this subcommittee, it's for like everything we're doing. And then, yes, I understand, like, I don't want to like ostracize people. It's not a requirement that they would fill anything out,
Right.
but just like dropping it in there and kind of even explaining to them, because I assume there is a contact element to these bags. Like, the bags are going to exist, like someone's going to give them the bags. Then the park, the police department, YMCA. And that was going to be my other thing is, can we bring together that larger group of everybody who is involved? The police department, the fire department, you guys over there, Rita, community member, like, can we get all of the people who specifically the hospital, because I know the hospital has a lot of efforts they do around this as well. Can we get like a bunch of people from those groups at the table so that we can sort of facilitate a conversation with them and further gather information? When I say we, I mean the homelessness subcommittee. So I don't know who that was. That was before I was here.
The homelessness subcommittee is everyone.
Oh, okay, cool.
Everyone picked a thing to do.
Oh, okay.
So we are it.
Okay, well then, yeah, for us.
Yes.
Then is there a way that we could, at some point, facilitate that conversation so that we can really figure out like where we're moving?
Yep. Done.
Cool.
All right, any other updates on this section?
A couple of names to kick out there, have on everybody's minds. Just had it, I think I lost. Outreach programs such as Access KC and Turning Point. Turning Point and Access KC. Those are two of the names that could be liaisons in this endeavor that we're trying to reach with the unhoused people. Just putting it up.
Thank you. All right, let's move on to strategic plan. And I think this one is going to get us into the weeds. It is 7:22. We have a 45-minute block to get through this chunk. If it takes more than 45 minutes, we will likely have to table it until next meeting. Just a reminder. Cool.
So hopefully we don't, because I sent all of this to Kim and Kristen actually like almost immediately after the last meeting. Most of this was just like my brain trying to process and do things, but the whole purpose of the committee is that we all come together and discuss these things. So, yeah. So for like strategic planning discussion, really what I would like for us is to set a work session so that we can actually hash out a lot of this. And if you would like to come to that work session, I feel like that would be the perfect place for sort of what you had planned here in helping us, and we can sort of figure that out in times and dates. But I guess just to sort of briefly discuss what I have sent you all, I think I already said like a really big takeaway is like data collection and information. We need more of that. So figuring out exactly what information we need and who we need it from is big. But last meeting, we sort of discussed it's the only meeting we had. Last meeting, we sort of discussed strategic planning as far as, I think there was just sort of like maybe some confusion around it as far as what it is. And I know like a couple of you guys were like, well, the purpose A through H's or whatever, like that is our strategic plan. That's more like if we're going on like a long distance road trip, we have to map out how we're gonna get there, right? So this is our route, and we sort of know where we're trying to go, but the A through H in our purpose is really just guidance. It is not direct or specific actions, right? And actually, like strategic planning is really fun for me. I love this, I'm not gonna lie. But we really want to figure out the work that we're doing, and we do have some ideas. Obviously, we have this like houselessness subcommittee type thing. And then Sai, at a previous meeting, you were the one who was like, it was when we were talking about the renaming and rebranding, and you were like, this is all important and everything, but I just want to like, can we pick some things and get to work? And you did ask everybody to come back with ideas and thoughts. So I would really love for that to be sort of one of the main things that we do in this work session that we plan, is everybody having some actionable items, thoughts, ideas, and or ideas to how we get to those actionable items, surveys, outreach, everything. But that is sort of all of this. So the onboarding and record keeping framework is really just for consistency and foundation so that this committee has the best chance of long-term sustainable success, which is, I think, we can learn from like the previous committee that laying that foundation and that groundwork is really important, and we know better now, so we can do better. And then everything else is how we achieve our purpose. So what are we doing towards those A through H, and how are we working on behalf of the city? So I think a lot of that is community input. And then I think I sort of mentioned in the previous committee that I love Jesse Smith's ad hoc community committees. I think those are amazing. I also think it's a really great way for a committee of 9 humans who are subject to various rules that allow us to not communicate, should I say, outside of the meeting super effectively. These ad hoc subcommittees are a really great way for work to get done in between the meetings while also bringing in community members and getting them involved. So every document that I sent you, with the exception of the next thing, which is developing the committee itself, I would really love for you guys to look through those. Feedback, as much feedback as we can have at the next meeting. I do have like a primer for the next meeting already ready to go that I can send you guys, and it does sort of sum this up a lot better and gives us some questions to think about before the work session so that we kind of know what we are working towards in the work session. But also, if you're going to be there, it sounds like you already have some really interesting, like engaging activities that could help us work through some of this. Yeah, that's fine. I will be here after. And then, so when we come back, I would love for us to have some ideas on this as far as the community engagement. It's kind of just what I already said. That is how that's the point, yeah. So everything that I sent you, yeah, I would love for everybody, I tried to get it to you guys like at the beginning of the month, so maybe we could talk about it, but I also knew we had other things happening, so we weren't gonna have a ton of time. But I will say, we have this weird little like cushion of 2 to 3 months before the next year, so getting a bunch of stuff done before the year so that we are sort of like established and ready to get going in January would be really cool. So yes, that's really all I have on that. And then that's what I was going to say. So can we kind of figure out days that will work well for everybody to be able to discuss?
Please get your calendars open. It gets spicy in the fall. So let's backtrack from the 13th. Historically, we have, I just saw my calendar invite for my birthday. Historically, we've made Saturdays work as well as Thursdays during our normal meeting time. Is anyone opposed to Thursdays during our meeting time on different weeks? Okay. So typically we use Thursday, or we either use Saturdays or Thursdays, alternating Thursdays during this time slot. We are hearing that Thursdays might not work well for Jess or Peggy.
Or me.
Or you. Okay, not Thursdays.
So how does Saturdays
Saturdays
sound
tend to
great.
work better.
We have moved gymnastics classes.
morning or afternoon on a Saturday ideal for?
Selfishly, I do not prefer mornings.
Okay. What about midday then? That's a good
That's
compromise
fine.
between you guys.
I do not.
She's a night owl.
I am a night owl.
Would it make it? Can we do it at like a coffee shop? Would that make it more palatable for the
Nope.
morning? Nope. All right.
But
Could we-
I'm
So
willing to
noon.
sacrifice.
Noon. We could
It
do
is
like
okay.
a solid noon.
I'm willing to sacrifice.
Could we do it at like a semi-kid friendly
Yes.
area?
Yeah.
If you look at my daughter, who's right there.
This
everywhere's
is a kid-friendly area.
I mean, everyone's kid friendly if they don't mind my kid running around. I don't mind. If y'all don't
Parkour.
We don't mind.
Exactly.
Okay, Saturday noon, which means we have the 12th. Is that this week? No, that's not this week. The 12th,
12th is this Saturday.
the 18th. Sorry, my work calendar is set up where it starts on Sunday and it ends on Saturday. I hate it. Saturday the 11th feels
Oh, yeah.
Oh,
That's my favorite. I know.
my dogs are not allowed.
Neither
Saturday
is
the
mine.
18th.
Are we just calling out dates right now?
I'm just saying dates.
I am fine with all Saturdays in October.
I am as well, with the exception of the 11th, since we just realized that it's the Halloween at the dog park. So it's a fun event if you guys.
I cannot on the 25th.
I cannot on the 25th because it's my mother's 91st birthday.
Congratulations.
Happy birthday.
So,
The 18th is what we're looking at.
okay.
But we also have one in November, do we not?
Yeah. I
So
think
we have the
one in
18th, and if we had to, we could look at November. But
Should we schedule two? I know sometimes that helps people be able to.
I will
attend
say,
one.
yeah, it might take more than one. But
It likely will.
do you want to? So then
We
first
can
one?
do,
Let's do two.
let's do the 1st at noon.
The 18th at noon.
Well, if we do the November 1st, that's the one in November.
Oh, okay. I thought you meant the first meeting, and I was like, yeah, the 18th.
Do we want to do that in the library like we've done in the past?
Sounds good.
Okay.
There's a lizard.
Oh yeah, very cool.
I'll volunteer to schedule those.
I can also maybe like tell my 14-year-old to run around with. But she loves the tiny humans. But I said like you can go hang and keep them entertained, do story times. She will. Noon is what we're looking at. Is that okay?
Also lunchtime.
Okay, so we can bring snacks.
Yeah.
So we know to bring snacks.
Noon to 2.
Yeah.
For one of these work sessions, did we want Lauren? And
Yes,
if so, do
if
these
possible.
dates sound good for you?
Good for you.
Cool. What class do you teach?
I can never promise that.
Very cool. Very cool. Yeah, no, this is very casual. Like I will probably still be in pajamas.
It sounds like you'll smell like self-care.
Yeah, exactly.
So that's,
And we can bring Febreze if needed. It's okay.
Okay, we've got those calendared. Look at us go. We're doing great.
Okay, just to confirm, October 18th and November 1st. Those are both Saturdays from noon to 2 p.m. at the library.
Yes.
Beautiful.
Yes. Good job. Look at us go. Functional and all that. All right. Are we ready to move on to the next thing? No, there's nothing to vote on. Okay, moving on to committee member comments.
Oh,
Number 8.
wait, no. We
Nope,
do have
just
one
kidding.
thing to vote on. The next thing was the ad hoc subcommittees.
Or vote, what are we voting on? You enlighten us.
Key point, it's I think it's like 4 ad hoc subcommittees. So definitely, again, what I said about the committees. So I had attached essentially like a way that we could create those. Yeah, no, this is for community members. This is so community members, similar to what Jesse Smith is doing. So community members can help us work on the things we're working on in between meetings, do, a lot of the like brainstorming and heavy lifting. So I did attach essentially just an outline, which we don't have to adopt the outline that I attached, but it was just to help us understand like what we would be looking for when we're trying to create like an ad hoc community subcommittee. So, like laying out the scope that we would, be looking at. I don't actually have the paper in front of me. Yes. So yeah, these are essentially, when you look at that piece of paper, it lays out what we would be looking at if in the future, we are working on other tasks and we wanted to get a bunch of community members on it. This is just sort of like an easy reference to know what we're looking for exactly. And then with that, I I don't know how I have to do this or if I even need to, but I did want us to then sort of immediately form an ad hoc subcommittee for the houselessness, so that some of you guys, I guess all of us, since we are the subcommittee, can start engaging with community members and trying to get them on board to join this subcommittee. So I don't know if I have to make like a formal thing.
Separate from the subcommittees they have?
Yes,
that-
a community
just-
subcommittee.
Okay.
I think.
I'm sorry to say this, but I don't know if this is a bylaws or, I mean, if you're gonna formalize this.
So it's not formalized, but do we need
I
to?
don't think we need
I
to
don't
because I
know that you-
believe there's something in our bylaws about having like community guest input
Yeah,
and support. Advisors.
sounds
Advisors.
familiar. I'd have to look. But yeah,
I believe that's what they're called. And I would see anyone who's joining on this in the subcommittee to be able to do that.
I'd have to look. It sounds right, but yeah, to do a formal, like, a formal name and all that, probably a bylaws thing. It would have to, otherwise. I'm trying to think back with the ad hoc committees that are creating, that Mayor Smith has talked about. I don't know for certain if they're doing bylaws or anything, or if they're just a group of people that are getting together and doing stuff.
Kathy, would you know you're on one of those subcommittees? Are they formalizing? Like, do they have bylaws, or are they just getting together and then reporting back to the city?
You mean ad hoc? Sorry.
Oh, I'm sorry. I didn't see your hand.
So we're just an ad hoc group, and I guess it is like formal, but we're not city formal. And we have, I missed the meeting last night, so now I'm vice president.
Oh. So they don't believe in consent there. Yeah, okay. We can
No.
teach them. It's fine.
Believe in consent.
We believe, yeah. We would never.
Sure. And I'm buying you a cape. But yeah, so we're different. We don't have sunshine laws. We don't have things
Yes.
like that to worry about. So it's different. We still get stuff done.
Yeah, I think you guys get a lot done, actually. It's really cool.
I know.
Okay.
Sometimes I feel like we don't. It's a lot. It's a lot. But yeah. Did that answer your question?
I think so, that it's not.
I mean, I can look into it, but right now I don't have an answer.
Okay, so then informally, can we as committee members just talk to some community members and sort of get them engaged in this topic and then sort of discuss that we are awaiting some answers on whether or not there is a formal subcommittee that they can join, well, when they can. But yeah, like start talking to your friends and neighbors and trying to, I know there's actually a lot of people in the community who really care about this specific issue, so I don't think that you will have a lot of trouble, or we will have a lot of trouble. But yeah, let's start tapping people and annoying them until they become civically engaged community members.
Would it be fair to have maybe our at least our first meeting, on the 18th, so we can get a little bit of a structure, so we have a little bit more to say, hey, here's what here's the goal, here's what we're aiming for, and I'll say have slightly more talking points and have more of a vision arrow, if you will, of where we're trying to go with this.
So I don't think it's attached, but I did have like a formal motion that included like the scope. I just didn't know if we would need it, but
Sure.
yes, like I will email that to them to email to you guys, and then you can review that, and then at that meeting, we can sort of like really.
Okay.
Are you talking about, oh, I don't know if that was me. Are you talking about like at that work session, kind of formulating like an elevator pitch? Like this is explaining like, hey, this is.
Yes, for lack of a better word, yes.
Okay.
Yes.
I got 30 seconds to tell you about this.
You're like, hey, here's why you should join. Come on, this is what we're doing.
So everybody's providing the same message. Yeah.
Yeah, so yes, consistency, but also, I'll just say, and just to make sure that we're all consistently aware of, what we're trying to hit.
So would this be like the Christmas food drive that you guys were talking about? Would this, I'm sorry, I'm not talking into my mic. Would this be something that we'd want a subcommittee so that we would have engaged people in the whole community? Would this be
Yes,
what
I can
we-
read the mission from just the thing that I said. It was to explore the needs, challenges, and opportunities for supporting unhoused residents in North Kansas City, strengthening connections between the city, service providers, community members, and recommend actionable steps to City Council that align, to the CEAC and City Council that align with the master plan values of safety, accessibility, and community pride. And essentially, the work they would do, the scope would be like assessing needs, gathering information on the current state of houselessness in North Kansas City, including barriers to housing stability, available services, and gaps, engaging the stakeholders. So they would probably be the ones to like talk to other residents, get their input and information, potentially. Again, I'm a really big fan of a survey. I think that we get a lot of good information there when it's done right, because they're not always done right. But yeah, and then to essentially identify opportunities, develop recommendations, and then I thought that we could do it for like a 6-month period so that we could sort of trial it and see how it works. They would come every month and sort of like they do at City Council, and give us like the updates on what they are working on, what they've gotten, whatever. And then, yeah, it just sort of, it makes it easier for us as a committee of 9 to get things done. And it hits our goals of community engagement, which is where we sort of like forage all our work from. Like whatever we're doing, it should be coming directly from the residents of North Kansas City. So anyways, like I said, I will email this to everybody, and then we can sort of like figure out exactly what they would work on, and maybe even like little, like this thing or, yeah.
That sounds good. Hey, I have a suggestion. I've been thinking about, there's something that we can use to make better use of communication, and we can use the technology that's already given to us in terms of this North Kansas City portal. I don't think we use that enough.
So it
do we still
changed.
have access to, everybody still have access to the portal?
No, it's
Because-
still like member, or it's like 2 at EIC or something like that. So I don't know if that ever shifted.
Yeah. Yes, I say we could. I say we need to update that and shift. We could share information like documents and so forth through there, and also
Technically, we can't. We can, but we can't.
We can talk about things on there. And
I just watched the last meeting where you guys talked about this, and
Oh, really?
ultimately what Mike said is it's still best practice to send all information through them to be disseminated from them to us individually, so there's never a perception of like making an agreement.
in lieu of the sunshine laws.
We can still put information there,
Yeah,
but we
that's
can't
what I
like
mean.
communicate with each other.
That's what I mean. We could share information that that everybody can see. Everybody can see at the same time.
And
And,
then
we can still stay clear of sunshine laws and so forth like that, police ourselves there. I'm
have to be
saying it's
very
just a
careful,
suggestion. There's that technology out there that I don't think we make good use of it, is what I'm saying.
I will agree with that.
Yeah, I thought Stephen got it set up after that. Stephen had got it set up in a way to where documents could be worked on.
Oh, that was at the like one of the second to last meetings. So if they did, I don't think we've heard anything back.
I missed the last meeting and the meeting before that. And I think the emails and the documents, that was a while back. I thought.
It was originally set up for a shared cloud storage location, and we all had an individual email.
Yeah.
Last time I checked, I was not able to access EIC Ward 3B at
Yeah.
NKC. Obviously, because of the name change, it's understandable. So I'm not sure if it's been updated since.
Yeah, it will be.
Okay, cool. Okay, cool. Yep. I love that. And I will say, we should at some point review the sunshine laws and how they pertain to each city committee. And this was also mentioned to me by somebody else in the city who works for the city, that this would actually not be a terrible idea for all committees, not just this committee, but to have like a little formalized, like this is the sunshine law and how it pertains to your role sitting on this committee. Because my understanding is we play a little loose with that sometimes.
Well, it'd be a good thing, Crystal. We could see if Crystal would do that, or Tom
She
Barcy
will.
would be a good one too.
Tom would be great.
All right, moving into committee member comments.
I want to thank Jess for all the work that she's done in these documents, and I think she'd be a great secretary.
Did we not vote on that? Okay, just checking.
I'm not really sure if this is the best place to say this or in announcements at the end, but whatever. And I'm going to read it so that I don't have to look up and won't get too sad. Unfortunately, I have to announce my resignation from the CEAC effective immediately. Due to staffing changes at work, I'll no longer be available for Thursday meetings after tonight. Furthermore, demands on my time at work going forward are at a point that I can no longer dedicate the consistent amount of time to the appointment that I feel is needed to do it justice. I want to thank the other appointees for working with me, even when I get passionate. I want to thank Councilmember Saper for stewarding the committee through some harsh waters, Councilmember Click for taking the helm going forward, and Councilmember Fitzgerald for being aware of my general demeanor and still thinking, yeah, they'll be good for the committee. Lastly, as I have stated multiple times in meetings before, I do feel it's important that this committee is more than the 9 appointees here. And I plan to continue to follow along and to be the first to volunteer for things when volunteers are needed and I am available. I know things have been uncertain with the committee in the wake of outside pressure to curtail efforts such as ours, but I believe that the committee is at a healthy point for growth. I'm excited to see it grow and to be involved in whatever capacity I can be. So don't worry, I will still be out there causing good trouble.
Actually, I guess I should piggyback on that. I'm also announcing, not retirement, I guess a resignation, I think is what you call it. And you kind of sort of upstaged me because much of what you said I was going to say. So I guess there's no real reason.
That's why I jumped in first.
Yeah, thanks to the city of North Kansas City and the city council and all of those who actually everybody that I work with who've allowed me to share in being on this committee. I think it's a great thing. And if we didn't have family commitments on both coasts, I would still be here. I still want to contribute however I can, and I still want to, we still plan on being a part of the community. So I still want to contribute however I can. And I think that this is a great start now. There's a lot of potential here. There's no reason for anybody to feel like that there's anything else other than success in this. I also noticed that the presenter tonight of the information, this couldn't have come at a better time. There are a lot of liaison opportunities. It comes right along with us talking about the strategic plan, as a matter of fact. And so I think it's a great thing. It's a great time to bow out. And thank you guys so much for letting me be a part of this, and keep doing what you're doing. Everybody, please keep doing what you're doing. Great set of people. Thank you.
Can I ask if either of you have any replacements in mind for yourselves? We can do the legwork, but if you just give me some names, I will go knock on some doors.
I'll look into it, but specifically, my specific appointment was at large. So Mayor Smith is working on that now.
I kind of maybe sort of do, but I don't want to throw any names out yet because I want to talk to them first and not scare them off.
You don't just want to
I haven't even gotten the bite yet, so I don't want to pull the line. But yes, I have people that I will be bugging about. And honestly, with what is going on at this point, it sounds like you all already have 2 built-in volunteers from the community.
I will do my comment real quick. So I just wanted to take a really quick moment to sort of disseminate some information from the meeting at City Council last night. I think as this committee moves forward, this is probably something we will also get into and discuss. But the gerrymandering and the redistricting that's happening at the state level is and will affect the city of North Kansas City. As this really awesome human, her name was Shelley Carmen Brown. Yeah, I loved it. Exactly. Oh, wow. Okay, cool. Well, she came. You should have done this part. She came yesterday and she was explaining about the organization People Not Politicians and how they have you guys can sign it to oppose this gerrymandering that's happening. She did also just very briefly explain that it will align our overall goals as a city with other areas that don't necessarily align with our priorities. Similar, I think right now it's like Smithville, so more rural areas that definitely don't necessarily care about public transportation, which is like a huge thing for us in North Kansas City. So if you guys would like to learn more about that and how you can volunteer, get involved, or sign the petition, mobilize.us/PNPMO. Mobilize.us/PNPMO. So people, not politicians, PNP, Missouri. And then, yeah, she said you guys could go there and find out ways to get involved or even learn how you guys can start helping push this petition around, but go check it out. Everybody, whether you live here or don't. And then, yeah, thank you so much for coming. I think that you coming perfectly aligned with what we are doing and discussing, and I really hope that we can build a really great relationship with you guys over there at Clay County Public Health. And then, yeah, as I sort of said earlier, in line with the city council talking about the why last night, a really cool thing that we could do as a committee is also figure out ways to make the why more engageable for the residents of North Kansas City specifically. And I did have one question. Do you know if that data that they gave us, does that data account for people who go to the YMCA not in North Kansas City but have our memberships here? Because I would do that when I was working and I had a membership.
It's North Kansas City residents that are members. And then North Kansas City employees.
So when I was working down, so I would go to a different YMCA. So when I would go and sign myself into the Y, it wasn't
particularly
here.
this one?
Yeah, other than our Y.
I'm not sure. I'll have to ask them that.
Okay, because those numbers are really low, but maybe not completely accurate. It's
maybe.
You can go to any
maybe.
Y with your
Could be.
membership, but I don't think so yesterday they had some information about our YMCA usage because our city spends about $10,000 a month, I believe, subsidizing.
Little over 11. Yeah.
Little over 11, subsidizing the YMCA membership. So they were trying to get some feedback and information on how well that's going and if we're really paying for a good thing, if we're really, getting the best of our money. And it really does seem like those numbers are pretty low. So we could help with engagement, but also I just wasn't sure if those numbers were completely accurate. If you are, going to the other Y and signing, and I don't think they're being oh, that person was from North Kansas City. Let's write it down and send it to them. So I don't know how accurate that data is. But yeah, we should really figure out some community challenges or just really ways to get North Kansas City residents to the Y, using the Y, and aware that we do have a subsidized membership if they don't know, because it's awesome. And that's it. They have an outreach pantry, Peggy said.
At the YMCA, they have an outreach pantry inside the building, and it's open Monday through Friday from 10 a.m. to 2 p.m. Also, the North Kansas City YMCA has a mobile food pantry on the first Friday of the month from 1:30 to 3. You just drive through or stop by and pick up food.
Would it be possible?
I don't know how public, but one time I was at the Y, and I didn't know they had this, and I just wondered, why are all those cars all lined up there? So it looked to me like there were a lot of people using it, but I have no idea of the numbers. We'd have to check with the Y to see.
Would it be possible to get somebody from the Y here in the same way that you came here so we can get more information about the programs they have? I know they have the Teen Tech Center, which you don't even have to be a member to have or to use. They have a lot of really cool resources there. They're part of Welcoming KC, so they work with, anyways. Is there some way that we could get somebody from the YMCA to come talk to our committee about what resources they have and how we can share resources?
Surely they have community outreach. So yeah, I'm sure.
And they also, last year when it was so cold, they let people come in and sit in the lounge area in there. They didn't. Yeah.
Do you know who it is right now? Okay. The Teen Tech Center. It is, actually. It's awesome. My daughter loves it. Okay.
We can get a hold of Andrea and
Set
see
something
if
up
she can
eventually.
come to a meeting.
Okay, cool.
All right, Council Member Click, it's your
Oh,
turn.
no, wait, I have something to say.
Oh, just kidding.
Yeah, okay, and I will be the last, I promise. So I just want to, one, Lauren, thank you so much for coming, for speaking with us, giving us all this amazing information and data. To Martin's point, this was a very opportune time, and I am excited about what will come from this. Also, Simon, Martin, you will be missed, but so thankful for who you are, all that you have done, everything that you brought to the table. We appreciate it. This is not goodbye at all, but just want to say thank you, Jess. Welcome. Thank you for all that you have done and are doing, will continue to do. And just thank you to everyone on this wonderful committee for your efforts and your energy. So just want to put that out there. I think with that, now I am done, and go right ahead.
Now it's your turn.
Great. Hello. Martin, Simon, sad to hear you're leaving. I just got here, but fine. No, I'm excited for everything that's ahead for y'all and for the committee. We, last night, or Tuesday, at the council meeting, Rita did come and talk pretty extensively about the NAC and some of the changes that she's making this year, specifically for the program for when it gets really cold, purchasing hotel rooms for people to stay the night when it's below 28 degrees. And so if you want to talk more about it, let me know. I'm curious to see. I asked her to kind of keep us updated on how the changes are going. I did ask the question about the Social Security card. Some of the requirements were a Social Security card, a driver's license, which I know can be kind of hard for people to have, especially if they're kind of like transient and not necessarily permanently in North Kansas City. I think it's a great vision to try to connect people with those programs to help them get that documentation. So that's just something that I had been thinking about from the meeting on Tuesday. I'm really curious about the NAC too. I've never actually been. So I want to go kind of talk to her and see just what even the space looks like. So I'm excited for that. I'm excited for the food drive. I think the work session will be great to have a kind of less formal, we can sit and chat in a just less formal environment. But I think that's all I have. Thank y'all.
Announcements.
They're leaving us.
That is true. Yep, that is true. I have a couple. If I could look, I think we're down to our last week or so of Hispanic Heritage Month, which has been a very cool month. I really love this time of year. I think it's a really interesting month to celebrate since each country is so different in Latin America. Definitely suggest that you look at the Google fact of the day. You'll learn lots of things, if not exploring in different ways. Second thing is I tried to get Shelly to come tonight. One, because she's my best friend and Lois loves it. And two, she is a wealth of knowledge. She's engaging deeply with Midtown Democrats, which is why she's not here. She's at a happy hour for that. But there is a training for being a signature person. And I'm going to try to get to one of those and drag as many of you with me as possible. Sai, you can be on that short list. Because I think if we are not working to prevent or to turn over gerrymandering in our state, we're doing something wrong. Because it will change what Missouri looks like in devastating ways. I will also try to get her to events because we've got a lot coming up. And she really loves Lois again. Like, she'll be there. But once I've got that training done, I promise I will be out way more than I normally am to try to help with that effort. And I hope some of you are willing to come with me.
Is she free tomorrow at 4? There's a block party. Those might be good places for her to come.
I will text her right now.
Erie
Ward 1,
Street?
Erie Street.
Are you on Erie Street? Are you behind me? Are you like directly behind me? Do you live next to Tony?
No, not quite direct.
Okay, there was a woman in a window, and I thought it was you. And my daughter was like, "That's not."
I was
her."
not the one in
And
the
literally,
window.
I was like, "I think that's Kristen," and she goes, "No." I was like, "Okay."
There's an assembly at my school.
Well, that's okay.
I'm not sure, but it started on September 15th. It goes until October 15th. So there might be. I would definitely Google it.
In the interest of other block parties that Bess's friend could come to and maybe get signatures, Halloween night, there is a block party on the 1200 block of 22nd Avenue. 22nd. Me and Sarah and a few friends have applied and are putting together a block party for trick-or-treating and all fun things Halloween. It's the next block over. Yeah. We have a lot of houses that are back to each other. Yes, not my block, the next block over.
Halloween. Are there any other announcements? May they be weird and cheerful. Well then, if not, it is 8:04 and I call the second meeting of the SEAC closed. Gavel.
Signs back, right?
No,
You're not
we
getting
don't
them
necessarily
back?
collect the signs back.
To
No,
reuse
because
them?
each
Okay.
sign has its own date and address.